Welcome. In this video, you'll tackle 50 high-yield Nclex pharmacology questions focused on antibiotics and peak/trough levels. These are the concepts that frequently challenge nursing students on exam day. Test your clinical judgment, sharpen your medication safety knowledge, and see if you can identify the correct answer before each explanation. Let's get started. Question 1. A 67-year-old client with methicillin-resistant Staphylococcus aureus, MRSA, bacteremia, is receiving intravenous vancomycin every 12 hours. The client has chronic kidney disease, estimated GFR 42 milliliters per minute, and the provider has ordered both peak and trough serum drug levels. The nurse reviews the laboratory schedule and notes that the laboratory technician plans to draw the trough level 3 hours before the next scheduled dose, and the peak level immediately before the infusion begins. Which nursing action is most appropriate? A. Allow the laboratory technician to collect both specimens because the provider specifically ordered peak and trough levels. B. Hold the vancomycin infusion until both samples are obtained because timing does not significantly affect interpretation. C. Contact the laboratory and request correction of the collection times because both samples are scheduled incorrectly. D. Administer the medication first, then collect both specimens immediately after the infusion is completed. Answer: C. Contact the laboratory and request correction of the collection times because both samples are scheduled incorrectly. Rationale: vancomycin trough levels are generally drawn immediately before the next dose, typically within 30 minutes, while peak levels, if ordered, are obtained after the infusion has distributed according to institutional protocol. Incorrect timing produces inaccurate results that can lead to inappropriate dosage adjustments and increase the risk of nephrotoxicity or treatment failure. Question 2. A client hospitalized with gram-negative septicemia is receiving gentamicin intravenously every 8 hours. On morning rounds, the nurse reviews the following data: peak gentamicin level, above therapeutic range. Trough gentamicin level, above therapeutic range. Serum creatinine, increased from 0.9 to 1.8 milligrams per deciliter over 48 hours. Urine output, decreasing. Temperature, afebrile. Which nursing action should the nurse perform first? A. Administer the scheduled gentamicin dose because the infection appears controlled. B. Hold the next gentamicin dose and notify the healthcare provider immediately. C. Increase the 4 infusion rate to improve renal perfusion. D. Encourage oral fluids and recheck laboratory values in 24 hours. Answer: B. Hold the next gentamicin dose and notify the healthcare provider immediately. Rationale: elevated peak and trough levels with worsening renal function strongly suggest aminoglycoside accumulation and toxicity. The priority is to withhold the medication and notify the provider before irreversible nephrotoxicity or ototoxicity develops. Question 3. A nurse prepares to administer the 4th dose of vancomycin scheduled for 1,000. The laboratory has not yet obtained the ordered trough level. At 0945, the laboratory technician arrives to collect the blood specimen. Which nursing action is most appropriate? A. Administer vancomycin immediately because delaying antibiotics promotes resistance. B. Wait until the trough specimen is collected before administering the scheduled dose. C. Cancel the trough level because the timing is no longer accurate. D. Administer half the prescribed dose until the laboratory result becomes available. Answer: B. Wait until the trough specimen is collected before administering the scheduled dose. Rationale: a vancomycin trough must be drawn immediately before the next dose. Administering the antibiotic before specimen collection invalidates the result and prevents accurate dosage adjustment. Question 4. A client receiving intravenous gentamicin reports ringing in both ears, difficulty hearing conversations, and a sensation of imbalance when walking to the bathroom. Which assessment finding requires the nurse's immediate intervention? A. Blood pressure of 136/82 mmHg. B. Mild nausea after breakfast. C. New-onset tinnitus with impaired balance. D. Heart rate of 94 beats/minute. Answer: C. New-onset tinnitus with impaired balance. Rationale: aminoglycosides can cause irreversible ototoxicity. Tinnitus, hearing loss, and balance disturbances are early warning signs requiring immediate discontinuation of therapy and provider notification. Question 5. A client receiving piperacillin-tazobactam asks why blood levels are not routinely drawn as they were when previously receiving gentamicin. Which nursing response is most accurate? A. Only oral antibiotics require blood monitoring. B. Gentamicin has a much narrower therapeutic index and higher toxicity risk. C. Piperacillin is never capable of causing adverse effects. D. Peak and trough levels are unnecessary for all beta-lactam antibiotics because they are ineffective. Answer: B. Gentamicin has a much narrower therapeutic index and higher toxicity risk. Rationale: aminoglycosides require therapeutic drug monitoring because of their narrow therapeutic range and significant risks of nephrotoxicity and ototoxicity. Most beta-lactam antibiotics do not require routine peak/trough monitoring. Question 6. A 74-year-old client is admitted with infective endocarditis caused by Enterococcus faecalis. The prescribed regimen includes intravenous ampicillin and gentamicin. Before administering the 5th scheduled dose of gentamicin, the nurse reviews the following assessment findings. Gentamicin trough, above the therapeutic range. Peak, within therapeutic range. Serum creatinine, increased from 0.8 milligrams per deciliter to 1.5 milligrams per deciliter over the past 72 hours. Urine output, 25 milliliters per hour for the last 6 hours. The client denies hearing changes or dizziness. Which nursing action is the priority? A. Administer the medication because the peak level is therapeutic. B. Hold the gentamicin dose and notify the healthcare provider immediately. C. Increase the 4 infusion rate and reassess urine output after 4 hours. D. Administer furosemide to improve urine output. Answer: B. Hold the gentamicin dose and notify the healthcare provider immediately. Rationale: an elevated trough indicates inadequate drug clearance and significantly increases the risk of nephrotoxicity. The rising serum creatinine and declining urine output support acute kidney injury. The medication should be withheld until the provider evaluates the client. Question 7. A client receiving intravenous vancomycin for MRSA pneumonia has a trough concentration that is below the therapeutic goal despite receiving every scheduled dose. The client remains febrile, and repeat blood cultures continue to grow MRSA. Which provider prescription would the nurse anticipate? A. Decrease the vancomycin dose. B. Increase the vancomycin dose or shorten the dosing interval. C. Discontinue vancomycin and begin oral amoxicillin. D. Delay the next dose by 24 hours. Answer: B. Increase the vancomycin dose or shorten the dosing interval. Rationale: a subtherapeutic trough suggests insufficient antibiotic exposure, increasing the risk of treatment failure. The provider will typically increase the dose or shorten the dosing interval while closely monitoring renal function. Question 8. A nurse is caring for a client receiving intravenous tobramycin for severe Pseudomonas aeruginosa sepsis. Which assessment finding is most concerning for aminoglycoside toxicity? A. Mild headache after the infusion. B. New onset hearing loss accompanied by vertigo. C. Heart rate of 102 beats/minute. D. White blood cell count decreasing toward normal. Answer: B. New onset hearing loss accompanied by vertigo. Rationale: hearing loss and vertigo are classic manifestations of aminoglycoside ototoxicity. Permanent damage may occur if therapy continues, so the provider should be notified immediately. Question 9. A client receiving vancomycin develops generalized flushing of the face, neck, and upper torso approximately 15 minutes after the infusion begins. Blood pressure is stable, respirations are unlabored, and no urticaria is present. Which nursing intervention is most appropriate? A. Discontinue vancomycin permanently because the client is experiencing anaphylaxis. B. Slow the infusion rate and notify the healthcare provider. C. Continue the infusion because this is an expected therapeutic effect. D. Administer epinephrine immediately. Answer: B. Slow the infusion rate and notify the healthcare provider. Rationale: this presentation is consistent with Redman syndrome, an infusion-related reaction caused by rapid vancomycin administration. Slowing the infusion and notifying the provider are appropriate. It differs from true anaphylaxis because airway compromise and severe hypotension are absent. Question 10. A client receiving intravenous amikacin has the following laboratory results available before the scheduled morning dose. Peak level, therapeutic. Trough level, elevated. Serum creatinine, 2.0 mg per deciliter, previously 1.1 mg per deciliter. Blood urea nitrogen, 40 mg per deciliter. Potassium, 4.3 milliequivalent/L. Temperature, 37.0 degrees Celsius 98.6 degrees Fahrenheit. Which interpretation by the nurse is most accurate? A. The medication is achieving the desired effect with no evidence of toxicity. B. The client is developing drug accumulation despite an adequate peak concentration. C. The infection is worsening because the peak level is therapeutic. D. The elevated trough confirms the medication should be administered immediately to maintain effectiveness. Answer: B. The client is developing drug accumulation despite an adequate peak concentration. Rationale: a therapeutic peak indicates adequate bacterial killing, but an elevated trough indicates poor drug clearance and accumulation. The rising serum creatinine confirms declining renal function, placing the client at high risk for aminoglycoside nephrotoxicity. The provider should be notified, and the dose is typically withheld pending further evaluation. Question 11. A 69-year-old client with MRSA osteomyelitis has been receiving intravenous vancomycin for 8 days. The nurse reviews the following morning laboratory results before administering the next dose. Vancomycin trough, 28 micrograms per milliliter. Serum creatinine, increased from 1.0 to 2.1 milligrams per deciliter. BUN, 42 milligrams per deciliter. Urine output, 20 milliliters per hour during the last 8 hours. Temperature, 37.1 degrees Celsius 98.8 degrees Fahrenheit. The client states, "I'm finally feeling much better." Which nursing action is the priority? A. Administer the vancomycin because the client is clinically improving. B. Hold the scheduled dose and notify the healthcare provider immediately. C. Encourage increased oral fluid intake and administer the medication. D. Repeat the trough level after the infusion is completed. Answer: B. Hold the scheduled dose and notify the healthcare provider immediately. Rationale: a markedly elevated vancomycin trough combined with worsening renal function indicates significant drug accumulation and increased risk for nephrotoxicity. Clinical improvement does not justify administering another dose. Question 12. A client with severe hospital-acquired pneumonia is receiving intravenous gentamicin. Before administering the morning dose, the nurse notes the following. Peak level, within therapeutic range. Trough level, within therapeutic range. Serum creatinine, stable. The client reports new ringing in both ears that began overnight. What is the nurse's priority action? A. Administer the medication because laboratory values are therapeutic. B. Hold the medication and notify the healthcare provider of possible ototoxicity. C. Document the finding as an expected side effect. D. Reassure the client that the symptom will disappear after treatment. Answer: B. Hold the medication and notify the healthcare provider of possible ototoxicity. Rationale: therapeutic drug levels do not eliminate the risk of toxicity. Tinnitus is an early manifestation of aminoglycoside ototoxicity and requires immediate evaluation. Question 13. A nurse is teaching a newly hired graduate nurse about serum antibiotic monitoring. Which statement by the graduate nurse demonstrates correct understanding? A. Peak levels are primarily monitored to evaluate the risk of kidney toxicity. B. Trough levels help determine whether excessive drug accumulation is occurring before the next dose. C. Trough levels should always be collected immediately after medication administration. D. Peak levels are unnecessary for aminoglycoside therapy. Answer: B. Trough levels help determine whether excessive drug accumulation is occurring before the next dose. Rationale: trough levels reflect the lowest serum concentration and help identify drug accumulation that increases the risk of toxicity, particularly with aminoglycosides and vancomycin. Question 14. A client receiving intravenous vancomycin suddenly develops wheezing, facial swelling, hypotension, generalized urticaria, and respiratory distress 5 minutes after the infusion begins. Which nursing action has the highest priority? A. Slow the infusion rate. B. Stop the infusion immediately and initiate emergency treatment for anaphylaxis. C. Continue the infusion because Redman syndrome is expected. D. Obtain another trough level before stopping the infusion. Answer. B. Stop the infusion immediately and initiate emergency treatment for anaphylaxis. Rationale: airway swelling, hypotension, wheezing, and urticaria indicate true anaphylaxis rather than Redman syndrome. Immediate discontinuation of the drug and emergency intervention are life-saving. Question 15. A client with infective endocarditis receives gentamicin every 8 hours. The nurse discovers that the trough level was mistakenly drawn 2 hours before the next scheduled dose, instead of immediately before administration. Which interpretation is most accurate? A. The trough result may falsely appear lower than the actual pre-dose concentration. B. The trough result remains completely accurate. C. The peak level becomes invalid instead. D. The gentamicin dose should automatically be doubled. Answer. A. The trough result may falsely appear lower than the actual pre-dose concentration. Rationale: drawing the trough too early can underestimate the drug concentration present immediately before the next dose, leading to inaccurate dosing decisions. Question 16. A client receiving amikacin reports progressive difficulty hearing high-pitched sounds. Which additional assessment finding would further support aminoglycoside toxicity? A. Persistent vertigo and unsteady gait. B. Productive cough with green sputum. C. Elevated blood glucose. D. Bradycardia with chest pain. Answer. A. Persistent vertigo and unsteady gait. Rationale: vestibular dysfunction, vertigo, balance problems, and hearing loss are classic manifestations of aminoglycoside ototoxicity. Question 17. A client with MRSA bacteremia has a vancomycin trough below the therapeutic goal despite receiving every prescribed dose. Which complication places the client at the greatest risk if inadequate serum concentrations continue? A. Permanent hearing loss. B. Failure to eradicate the infection and development of bacterial resistance. C. Hyperkalemia. D. Severe hypoglycemia. Answer. B. Failure to eradicate the infection and development of bacterial resistance. Rationale: subtherapeutic antibiotic concentrations reduce bacterial killing, increasing the risk of persistent infection and promoting antimicrobial resistance. Question 18. A nurse reviews laboratory data for 4 clients receiving intravenous antibiotics. Which client should the nurse assess first? A. Client receiving ceftriaxone with mild diarrhea. B. Client receiving vancomycin whose trough level is critically elevated and whose urine output has fallen significantly. C. Client receiving azithromycin with mild nausea. D. Client receiving penicillin reporting discomfort at the foresight. Answer. B. Client receiving vancomycin whose trough level is critically elevated and whose urine output has fallen significantly. Rationale: a critically elevated vancomycin trough and decreased urine output suggest impending nephrotoxicity, requiring immediate intervention. Question 19. A client receiving gentamicin asks why kidney function tests are ordered almost every day. Which nursing response is most appropriate? A. The medication can damage the kidneys if blood concentrations become too high. B. Kidney tests are ordered for every hospitalized client. C. The laboratory accidentally repeats these tests. D. The medication lowers kidney function in every client. Answer. A. The medication can damage the kidneys if blood concentrations become too high. Rationale: aminoglycosides are nephrotoxic, especially when trough levels remain elevated. Frequent monitoring helps detect toxicity early so therapy can be adjusted. Question 20. A nurse prepares to administer intravenous vancomycin. Which action best reduces the risk of infusion-related Redman syndrome? A. Administer the medication rapidly over 15 minutes. B. Infuse the medication slowly over the recommended period using an infusion pump. C. Dilute the medication with sterile water only and administer as in 4 push. D. Administer the medication intramuscularly if flushing develops. Answer. B. Infuse the medication slowly over the recommended period using an infusion pump. Rationale. Redman syndrome is most commonly caused by rapid vancomycin infusion. Administering the drug slowly, typically over at least 60 minutes, longer for larger doses, greatly reduces the risk. Question 21. A 72-year-old client with MRSA prosthetic valve endocarditis has received intravenous vancomycin for 10 days. During the morning assessment, the nurse reviews the following data. Vancomycin trough, 24 micrograms per milliliter. Serum creatinine, increased from 0.9 milligrams per deciliter to 1.9 milligrams per deciliter. Urine output, averaging 25 milliliters per hour for the past 12 hours. Blood cultures, negative for the past 72 hours. Client reports no hearing changes. The next dose is due in 20 minutes. Which nursing action is most appropriate? A. Administer the dose because the blood cultures are now negative. B. Hold the scheduled dose and notify the healthcare provider of probable vancomycin accumulation. C. Administer half of the prescribed dose and document the laboratory results. D. Delay the dose for 1 hour and then administer the full amount. Answer. B. Hold the scheduled dose and notify the healthcare provider of probable vancomycin accumulation. Rationale. An elevated vancomycin trough with worsening renal function indicates significant drug accumulation and increased nephrotoxicity risk. The nurse should withhold the medication and notify the provider before additional renal injury occurs. Question 22. A client with severe gram-negative sepsis is receiving extended interval, once daily, gentamicin therapy. The nurse understands that the primary advantage of extended interval dosing is which pharmacologic principle? A. Aminoglycosides exhibit concentration-dependent bacterial killing and a post-antibiotic effect. B. Once daily dosing completely eliminates nephrotoxicity. C. Peak and trough monitoring are never required with once daily dosing. D. The medication becomes bacteriostatic rather than bactericidal. Answer. A. Aminoglycosides exhibit concentration-dependent bacterial killing and a post-antibiotic effect. Rationale. Aminoglycosides kill bacteria more effectively at higher peak concentrations and continue suppressing bacterial growth even after serum levels fall, post-antibiotic effect. This allows effective once-daily dosing while potentially reducing toxicity. Question 23. A nurse is preparing to administer the next dose of gentamicin. The electronic medical record displays the following. Peak level, therapeutic. Trough level, elevated. Creatinine clearance, decreasing. Client reports normal hearing. Which interpretation is most accurate? A. The medication is working safely because the peak is therapeutic. B. Drug clearance is impaired, increasing the risk for toxicity despite an adequate peak. C. The infection has become resistant. D. The medication should be administered earlier than scheduled. Answer. B. Drug clearance is impaired, increasing the risk for toxicity despite an adequate peak. Rationale. A therapeutic peak confirms adequate bactericidal activity, but an elevated trough indicates impaired elimination and drug accumulation, placing the client at high risk for nephrotoxicity and ototoxicity. Question 24. A client receiving intravenous vancomycin suddenly develops diffuse erythema over the neck, chest, and back approximately 20 minutes after the infusion begins. Blood pressure is 124/78 mmHg. Oxygen saturation is 98% on room air, and lung sounds are clear. Which intervention should the nurse perform first? A. Stop the infusion permanently and prepare for intubation. B. Slow or temporarily stop the infusion and notify the healthcare provider. C. Administer epinephrine immediately. D. Continue the infusion because flushing is expected. Answer. B. Slow or temporarily stop the infusion and notify the healthcare provider. Rationale. The findings are most consistent with Redman syndrome rather than anaphylaxis. Slowing or temporarily stopping the infusion usually resolves symptoms. Future doses should be infused more slowly. Question 25. A client receiving intravenous tobramycin reports difficulty understanding conversations despite wearing hearing aids. Which additional assessment finding most strongly suggests progressive ototoxicity? A. Persistent dizziness when standing and an unsteady gait. B. Elevated white blood cell count. C. Increased appetite. D. Mild peripheral edema. Answer: A. Persistent dizziness when standing and an unsteady gait. Rationale: aminoglycosides affect both the cochlear and vestibular branches of the 8th cranial nerve, causing hearing loss, vertigo, and balance disturbances. Question 26. A nurse receives change of shift report on 4 clients receiving antibiotics. Which client should the nurse assess first? A. A client receiving cefazolin with mild pain at the 4 insertion site. B. A client receiving vancomycin whose trough level is critically elevated and who reports decreased urine output. C. A client receiving doxycycline who reports mild photosensitivity. D. A client receiving amoxicillin who has mild nausea after meals. Answer: B. A client receiving vancomycin whose trough level is critically elevated and who reports decreased urine output. Rationale: a critically elevated trough combined with oliguria strongly suggests nephrotoxicity, making this client the highest priority. Question 27. A client receiving intravenous gentamicin asks why the medication is infused over the prescribed time instead of being administered rapidly. Which nursing response is most appropriate? A. Rapid administration increases the risk of toxicity and adverse reactions. B. The medication only works if it is infused slowly. C. A rapid infusion destroys the antibiotic. D. The medication becomes ineffective after 30 minutes. Answer: A. Rapid administration increases the risk of toxicity and adverse reactions. Rationale: gentamicin should be administered according to recommended infusion guidelines to help minimize adverse effects and maintain safe therapeutic concentrations. Question 28. A client receiving vancomycin therapy develops acute kidney injury. Which additional medication in the client's regimen should the nurse recognize as increasing the risk for nephrotoxicity? A. Acetaminophen. B. Furosemide. C. Calcium carbonate. D. Docusate sodium. Answer: B. Furosemide. Rationale: concurrent use of vancomycin with other nephrotoxic or ototoxic medications, including loop diuretics such as furosemide, increases the risk of kidney injury and hearing damage. Question 29. A nurse is teaching a client who will continue intravenous vancomycin therapy at home. Which statement by the client indicates the need for further teaching? A. I'll report decreased urine output immediately. B. I'll notify my healthcare provider if I notice ringing in my ears. C. If I develop flushing during the infusion, I'll increase the infusion speed so it finishes sooner. D. I'll keep my scheduled laboratory appointments. Answer: C. If I develop flushing during the infusion, I'll increase the infusion speed so it finishes sooner. Rationale: increasing the infusion rate worsens Redman syndrome. The infusion should be slowed or temporarily stopped, and the healthcare provider should be notified. Question 30. A client receiving amikacin has the following assessment findings. Peak level, therapeutic. Trough level, elevated. Serum creatinine, increased. New complaint of tinnitus. Temperature, normal. Which nursing intervention is the priority? A. Administer the scheduled dose because the infection appears controlled. B. Hold the medication and notify the healthcare provider immediately. C. Encourage the client to increase fluid intake before receiving the dose. D. Repeat the peak level after the infusion. Answer: B. Hold the medication and notify the healthcare provider immediately. Rationale: the combination of an elevated trough, worsening renal function, and tinnitus indicates significant aminoglycoside toxicity. The medication should be withheld, and the provider notified immediately to prevent irreversible nephrotoxicity and ototoxicity. Question 31. A 66-year-old client with MRSA bacteremia is receiving intravenous vancomycin. Before the scheduled 0-900 dose, the nurse reviews the following. Vancomycin trough, 27 micrograms per milliliter. Serum creatinine, increased from 0.8 milligrams per deciliter to 1.9 milligrams per deciliter. Urine output, 18 milliliters per hour during the past 6 hours. Blood pressure, 128, 74 mmHg. Temperature, 37.2 degrees Celsius 99 degrees Fahrenheit. The provider has not yet reviewed the laboratory results. Which nursing action is most appropriate? A. Administer the dose because the client is hemodynamically stable. B. Hold the vancomycin and notify the healthcare provider immediately. C. Administer half the dose until new laboratory results are obtained. D. Delay the infusion for 30 minutes and then administer the medication. Answer: B. Hold the vancomycin and notify the healthcare provider immediately. Rationale: a critically elevated vancomycin trough with worsening renal function indicates drug accumulation and increased nephrotoxicity risk. The medication should be withheld pending provider evaluation. Question 32. A client receiving gentamicin for gram-negative sepsis states, "The room feels like it's spinning whenever I get out of bed." Which nursing interpretation is most accurate? A. The client is experiencing orthostatic hypotension unrelated to the medication. B. The symptoms may indicate vestibular toxicity caused by gentamicin. C. The client is developing hypoglycemia. D. This is an expected response to antibiotic therapy. Answer: B. The symptoms may indicate vestibular toxicity caused by gentamicin. Rationale: aminoglycosides can damage the vestibular portion of cranial nerve 8, causing vertigo, dizziness, and gait instability. These findings require immediate provider notification. Question 33. A nurse is caring for 4 clients receiving intravenous antibiotics. Which client requires immediate assessment? A. A client receiving ceftriaxone who reports loose stools twice today. B. A client receiving vancomycin who develops wheezing, facial swelling, hypotension, and generalized urticaria during the infusion. C. A client receiving doxycycline who reports mild photosensitivity. D. A client receiving azithromycin with mild nausea. Answer: B. A client receiving vancomycin who develops wheezing, facial swelling, hypotension, and generalized urticaria during the infusion. Rationale: these findings indicate anaphylaxis, a life-threatening emergency requiring immediate discontinuation of the infusion and emergency treatment. Question 34. A client receiving amikacin has therapeutic peak and trough levels. Which assessment finding should still prompt the nurse to notify the healthcare provider immediately? A. Mild fatigue. B. New-onset tinnitus and decreased hearing. C. Heart rate of 88 beats/minute. D. Temperature of 37 degrees Celsius 98.6 degrees Fahrenheit. Answer: B. New-onset tinnitus and decreased hearing. Rationale: ototoxicity may occur even when serum drug levels are within the therapeutic range. Early recognition helps prevent permanent hearing loss. Question 35. A nurse is preparing to collect a vancomycin trough level for a client receiving doses every 12 hours. Which action demonstrates correct technique? A. Draw the specimen immediately after completing the infusion. B. Draw the specimen approximately 30 minutes before the next scheduled dose. C. Draw the specimen halfway between scheduled doses. D. Draw the specimen 2 hours after the infusion begins. Answer: B. Draw the specimen approximately 30 minutes before the next scheduled dose. Rationale: a trough level is obtained immediately before the next dose, typically within 30 minutes, to measure the lowest serum concentration and evaluate drug accumulation. Question 36. A client receiving intravenous tobramycin has these laboratory results. Peak, therapeutic. Trough, elevated. Serum creatinine, rising. Urine output, decreasing. Which pathophysiologic process best explains these findings? A. Accelerated hepatic metabolism. B. Reduced renal clearance resulting in drug accumulation. C. Increased gastrointestinal absorption. D. Enhanced protein binding. Answer: B. Reduced renal clearance resulting in drug accumulation. Rationale: aminoglycosides are eliminated primarily by the kidneys. Declining renal function causes accumulation, reflected by elevated trough levels and increasing nephrotoxicity. Question 37. A client asks why blood samples must be drawn at very specific times during gentamicin therapy. Which nursing response is most appropriate? A. The exact timing helps determine whether the medication concentration is both effective and safe. B. The laboratory prefers collecting blood at those times. C. The timing is mainly for insurance documentation. D. The medication loses effectiveness if blood is drawn late. Answer. A. The exact timing helps determine whether the medication concentration is both effective and safe. Rationale. Therapeutic drug monitoring depends on precise timing. Incorrect collection times may lead to inaccurate interpretation and inappropriate dosage adjustments. Question 38. A client develops generalized flushing without hypotension during a vancomycin infusion. Which assessment finding would indicate the reaction has progressed from Redman syndrome to anaphylaxis? A. Warmth over the face and neck. B. Diffuse erythema. C. Stridor with airway swelling and hypotension. D. Mild pruritus. Answer. C. Stridor with airway swelling and hypotension. Rationale. Airway compromise and hypotension are hallmark features of anaphylaxis and require immediate emergency treatment, unlike Redman syndrome. Question 39. A client with chronic kidney disease is prescribed gentamicin. Which factor places the client at the greatest risk for aminoglycoside toxicity? A. Reduced renal excretion of the medication. B. Increased gastrointestinal absorption. C. Increased hepatic metabolism. D. Increased red blood cell production. Answer. A. Reduced renal excretion of the medication. Rationale. Aminoglycosides are excreted almost entirely by the kidneys. Impaired renal function prolongs drug elimination, increasing the risk of elevated trough levels and toxicity. Question 40. A nurse evaluates a client receiving intravenous vancomycin. Which assessment finding best indicates the medication is being administered safely? A. The infusion is delivered over the recommended time. Trough levels are within the target range. Renal function remains stable, and the client reports no hearing changes. B. The medication is infused rapidly to complete treatment sooner. C. Trough levels are elevated, but the client feels well. D. Serum creatinine continues to rise despite therapeutic trough levels. Answer. A. The infusion is delivered over the recommended time. Trough levels are within the target range. Renal function remains stable, and the client reports no hearing changes. Rationale. Safe vancomycin therapy requires appropriate infusion duration, therapeutic drug monitoring, stable renal function, and ongoing assessment for nephrotoxicity and ototoxicity. Question 41. A 70-year-old client is receiving intravenous gentamicin for multi-drug-resistant, gram-negative bacteremia. Before administering the morning dose, the nurse reviews the following assessment data. Peak level, therapeutic. Trough level, critically elevated. Serum creatinine, increased from 1.1 milligrams per deciliter to 2.3 milligrams per deciliter over 72 hours. Urine output, 18 milliliters per hour. The client reports ringing in both ears and difficulty maintaining balance while walking. Which nursing action is the highest priority? A. Administer the prescribed dose because the peak level is therapeutic. B. Hold the medication and notify the healthcare provider immediately. C. Encourage oral fluids and administer the medication as prescribed. D. Obtain another peak level after the infusion. Answer. B. Hold the medication and notify the healthcare provider immediately. Rationale. The elevated trough, acute kidney injury, tinnitus, and balance disturbances indicate severe aminoglycoside toxicity. The medication should be withheld immediately to reduce the risk of permanent nephrotoxicity and ototoxicity. Question 42. A client receiving intravenous vancomycin develops diffuse flushing and pruritus approximately 15 minutes after the infusion begins. Respirations are unlabored, blood pressure is stable, and no facial swelling is noted. Which nursing intervention is most appropriate? A. Continue the infusion at the same rate. B. Slow or temporarily stop the infusion and notify the healthcare provider. C. Administer intramuscular epinephrine immediately. D. Permanently discontinue vancomycin without notifying the provider. Answer. B. Slow or temporarily stop the infusion and notify the healthcare provider. Rationale. These findings are consistent with Redman syndrome, an infusion-related reaction caused by rapid vancomycin administration. Slowing the infusion typically resolves symptoms. Question 43. A nurse receives provider prescriptions for 4 clients receiving intravenous antibiotics. Which prescription should the nurse question? A. Obtain a vancomycin trough level approximately 30 minutes before the next scheduled dose. B. Draw a gentamicin trough immediately after the medication infusion is completed. C. Monitor serum creatinine during aminoglycoside therapy. D. Assess hearing changes in clients receiving aminoglycosides. Answer. B. Draw a gentamicin trough immediately after the medication infusion is completed. Rationale. A trough level must be drawn immediately before the next dose, not after the infusion. Drawing it after administration produces an inaccurate result. Question 44. A client receiving amikacin states, I don't understand why you're asking me every day if my hearing has changed. Which nursing response is most appropriate? A. This medication can sometimes damage the hearing and balance nerves. B. It's part of the hospital admission questionnaire. C. Everyone receiving antibiotics develops hearing loss. D. The medication only affects vision. Answer. A. This medication can sometimes damage the hearing and balance nerves. Rationale. Aminoglycosides can cause both cochlear, hearing, and vestibular, balance, toxicity. Early recognition may prevent permanent injury. Question 45. A nurse reviews the laboratory results of a client receiving vancomycin trough within the target therapeutic range. Serum creatinine, stable. Urine output, adequate. Temperature, return to normal. White blood cell count, trending downward. Which conclusion is most appropriate? A. The therapy appears effective without evidence of significant toxicity. B. Vancomycin should be discontinued immediately. C. The client is developing nephrotoxicity. D. The vancomycin dose should be doubled. Answer. A. The therapy appears effective without evidence of significant toxicity. Rationale. Therapeutic trough levels, stable kidney function, and improving clinical indicators suggest that the antibiotic regimen is both effective and safe. Question 46. A client receiving intravenous tobramycin develops progressively worsening renal function despite therapeutic peak levels. Which laboratory value should the nurse evaluate most closely before administering the next dose? A. Trough concentration. B. Hemoglobin level. C. Platelet count. D. Serum calcium level. Answer. A. Trough concentration. Rationale. The trough level best reflects drug accumulation before the next dose and is the primary indicator of nephrotoxicity risk in aminoglycoside therapy. Question 47. A nurse is teaching a newly licensed nurse about medications that commonly require therapeutic drug monitoring. Which antibiotics should the nurse include? Select all that apply. A. Vancomycin. B. Gentamicin. C. Tobramycin. D. Amikacin. E. Amoxicillin. F. Cefazolin. Answer. A, B, C, and D. Rationale. Vancomycin and the aminoglycosides, gentamicin, tobramycin, and amikacin, commonly require therapeutic drug monitoring because of their narrow therapeutic index and potential for nephrotoxicity and ototoxicity. Routine peak/trough monitoring is not typically required for amoxicillin or cefazolin. Question 48. A client with chronic kidney disease is prescribed vancomycin. Which finding most strongly suggests the medication is accumulating to toxic levels? A. Increasing urine output. B. Rising serum creatinine accompanied by an elevated trough concentration. C. Mild nausea after meals. D. Low-grade fever. Answer. B. Rising serum creatinine accompanied by an elevated trough concentration. Rationale. Elevated trough levels and worsening renal function are classic indicators of vancomycin accumulation and nephrotoxicity. Question 49. A nurse is caring for a client receiving gentamicin. Which assessment finding requires the most immediate follow-up? A. The client reports difficulty hearing the television and persistent ringing in both ears. B. The client has mild nausea after breakfast. C. The client reports fatigue after physical therapy. D. The client requests assistance with sleep. Answer. A. The client reports difficulty hearing the television and persistent ringing in both ears. Rationale. Hearing loss and tinnitus are early manifestations of aminoglycoside ototoxicity and require immediate provider notification to prevent permanent auditory damage. Question 50. A nurse is evaluating the effectiveness and safety of intravenous vancomycin therapy in a client with MRSA bacteremia. Which assessment findings best indicate optimal therapeutic management? A. Therapeutic trough concentration, stable renal function, improving clinical status, and absence of hearing changes. B. Elevated trough concentration with declining urine output. C. Rapid infusion with facial flushing during every dose. D. Rising serum creatinine despite negative blood cultures. Answer: A. Therapeutic trough concentration, stable renal function, improving clinical status, and absence of hearing changes. Rationale: successful vancomycin therapy is demonstrated by therapeutic serum concentrations, preserved renal function, clinical improvement, and no evidence of nephrotoxicity or ototoxicity. These findings indicate effective treatment while minimizing adverse effects. Excellent work completing all 50 questions. Consistently practicing challenging pharmacology scenarios like these builds the confidence and clinical judgment you need for the NCLEX and real-world nursing practice. If you found this review helpful, keep practicing regularly, review the rationales, and challenge yourself with more high-yield questions. Thanks for watching, and all the best in your NCLEX preparation.